My name is Paul Matter, Jr. I'm a flight paramedic with the Lifeline Critical Care Transport Service. I enjoy treating patients, meeting their families. I enjoy working with my colleagues. And also feeling a sense of satisfaction of a good outcome. The average day is approximately 4 flights for the entire program. The individual base or the individual aircraft depends upon the luck of the draw. There are days where we don't have any flights, and then there's days where we've actually had 6 flights in 6 hours. Working in the back of the helicopter is very similar to the back of the ambulance, except you can't stand up and move around. Most of the times when we treat patients, we're dealing it from a seated position or else kneeling at the bedside, and you can do everything in the back of the helicopter that you can do in the back of the ambulance except stand up. To this day, I can remember a flight that I was on where we found an elderly gentleman and his lovely wife were in an outlying hospital, and he was having a lot of respiratory distress, and it was evident that he was in congestive heart failure. At that time, the gentleman who was in distress was apologizing, inconveniencing us to transport him, knowing that this was one of the worst days in his life. We took the time to talk to his wife and explain to him and also his wife that we were going to have to put in a breathing tube. He was going to need to be intubated. And we allowed his wife just to have a few minutes to be able to speak with him prior to passing the endotracheal tube, knowing that more than likely she would not be able to speak with him or hear his voice again. I think the Lifeline Aeromedical Program brings a commitment by the crew to provide the best possible care and compassion that we can muster. My advice to anybody who's considering getting into the aeromedical practice, it's very rewarding, very satisfying, very challenging. There will be those times when you'll just be on top of the earth feeling really good about what you're doing. And there'll be other times when you feel very low, wondering, what good you're doing. But overall, I'd say it was very satisfying and has been very rewarding for me. And it's been an honor and a privilege to be a part of the Lifeline Aeromedical Program.